Today I will be reading out of my global health textbook. Uh, Hopefully I can stay awake. Global health brings together partners from around the world to solve shared population and environmental health concerns. Investments in global health are motivated by a desire to improve millions of lives, prevent avoidable illness and deaths, mitigate transnational threats like pandemics and climate change, promote health equity, protect international trade and security. Global health is a field of academic study, research, and applied practice that seeks to improve population health worldwide. The word global conveys two meanings: worldwide and comprehensive. Some global health initiatives focus on health concerns that primarily affect people who live in low income countries, but most seek to address complex transnational problems that affect or have the potential to affect people in every country. Global health researchers take a holistic approach to examining the many socioeconomic, environmental, political, and other contributors to health and well being. And global health practitioners apply tools from public health, medicine, environmental science, the social sciences, engineering, law, and other professions towards the improvement of population and environmental health in countries and communities across the globe. Some of the core values that guide global health can be summarized by the acronym PACES: population, action, cooperation, equity, and security. The population dimension of global health emphasizes that global health interventions typically target health issues that adversely affect large numbers of people across multiple world regions. Some global health initiative focuses on the diseases that cause the most deaths, disability, and lost productivity worldwide. Some target emerging threats to population health and have the potential to affect every country in the world in the future, such as pandemic influenza and global warming. Some aim to improve the socioeconomic and environmental conditions that cause millions or even billions of people worldwide to have suboptimal health status. The action lens accentuates the value of global health principles and theories leading to improved health in the real world. Global health researchers use scientific studies to identify the most effective and economical interventions for prioritized health issues. Then practitioners use those research findings to design and implement policies and practices that will prevent new population health problems and solve existing concerns. Many global health initiatives seek to increase access to health literacy, safe drinking water, essential medicines, nutritious foods, and other fundamental tools for preventing, diagnosing, and treating health problems. Because these have been identified as some of the best buys that yield the greatest benefits for population health per dollar spent. The cooperation aspect of global health recognizes that there are many cross-border threats to population health and well-being that only can be solved through international partnerships. Pollution, generated in one country may adversely affect the air and water quality of many neighboring lands. A drug-resistant strain of tuberculosis or another infection that emerges in one nation may quickly spread around the globe. One country acting alone cannot contain these hazards to health. Solving these global challenges will require governments and representatives from business and other sectors in many countries to work together to identify priorities, generate action plans, and follow through on achieving shared goals. An equity lens brings attention to health issues that predominantly affect low-income countries and other disadvantaged populations and marginalized groups. Health equity is present when everyone has an equal opportunity to be as healthy as possible. High-income countries have experienced significant improvements in population health status over the past century as they have become wealthier, built infrastructure that support healthy living, and expanded access to medications, surgery, vaccines, and other health technologies. Health status in low-income countries is improving, but life expectancy and other health metrics are still less favorable in these areas than in higher income places. Besides these between country gaps in health status, there are also within country health inequalities. For example, people with mental health disorders in any country may encounter systemic challenges to accessing healthcare and social services. Many global health campaigns are guided by social justice principles and seek to ensure that the voices of individuals who represent marginalized groups are heard so that the needs of their communities can be acknowledged and acted on. The security aspect of global health underscores health as a foundation for safe and peaceful societies. Places that are burdened by infectious disease outbreaks, chronic hunger, on high rates of preventable disability, and early death due to lack of access to routine medical, surgical, and psychological care may experience economic turmoil and political unrest. Instability may lead to violent conflict, and conflict in one place may lead to disruptions and violence in other locations. Investments in global health can support economic growth, political stability, and national and international security. Many diseases, environmental hazards, and other population health issues are classified as global health priorities based on the PACE's criteria. Pandemics are one obvious example of a global health priority. Within a few months after COVID-19 was first identified in late 2019, the coronavirus spread to dozens of countries and met all five of the PACE's criteria. Population: billions of people were at risk of SARS-CoV-2 infection, millions became infected, and hundreds of thousands of people died from the infection. Action: control measures such as testing, contact tracing, and isolation and treatment of infected individuals were widely deployed to slow and spread of the virus while researchers worked to develop test medications and vaccines. Cooperation: national efforts to respond to the pandemic relied on global sharing of information about the most effective protocols for diagnosing SARS-CoV-2 infection and treating COVID-19 patients, and decisions related to international travel and trade were dependent on reliable access to up-to-date statistics about case counts and locations. Equity: the pandemic affected some populations disproportionately, with healthcare, food services, and other essential workers at high risk of on-the-job exposure to SARS-CoV-2, and older adults and people with chronic diseases especially vulnerable to severe illness and death after contracting the virus. Security: the emergence of COVID-19 caused major social and economic disruptions due to school and workplace closures, travel bans, supply chain interruptions, and other hardships. The PACE's criteria can similarly be used to justify investment in interventions for a diversity of other health issues such as HIV and AIDS, maternal mortality, child hunger, hypertension, lower back pain, and depression. All these health concerns and many more can become global health foci when groups of people representing diverse cultures and nationalities work together to raise awareness about health issues and then solve them. 1.2 Population Health. The goal of global health is to improve the health of the world's people. Health is often defined as the absence of disease or injury, but that is an incomplete explanation because the focus is on what health is not, rather than what health is. Some definitions of health emphasize the ability to conduct normal daily activities, but that construct is inadequate because the definition of normal varies from person to person. For example, many people assume that it is normal for an older adult to have limited mobility and forgetfulness, but that is not an inevitability. Many older people are very active and mentally sharp, and therapy and assistive technologies could improve the quality of life of many seniors who have joint pain and memory loss. Similarly, parents in many parts of the world assume that it is normal for children to have intestinal worms. Even though a cheap medication can kill these parasites, millions of children are currently living with untreated intestinal worms that can significantly impair their health, growth, and school performance. A more comprehensive definition of health encompasses both physical and mental health, as well as the presence of social connections that facilitate health. The Constitution of the World Health Organization, written in 1948, defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This definition recognizes that health is about more than just biology. It is also about psychology, sociology, and a host of other factors. Although there is almost no one in the world today who would be classified as having complete health according to the WHO, World Health Organization, statement, this definition provides a target for medical and public health professionals and organizations as they work together to improve the health status of individuals and communities. Global health initiatives aim to improve health at the population level. A population is a group of individuals, communities, nations, or other entities. Some global health interventions seek to improve the well-being of large regions or the entire world population. For example, strengthening early warning systems for emerging infections, diseases that could cause pandemics is an action that protects all humans, not just a few selected individuals or countries. Some global health interventions provide services directly to individuals because healthier individuals collectively will form healthier populations. Health is improved when infectious diseases such as HIV, tuberculosis, cholera, influenza, measles, and malaria, and non-communicable diseases such as cardiovascular disease, cancer, and diabetes are prevented, managed, or cured. Health is improved when nutritional deficiencies like protein, energy, malnutrition, and iron deficiency, anemia are remediated. Health is improved when women do not die in childbirth, when people who have depression and anxiety have access to counseling and medications, and when people who are injured in a traffic collision or an act of violence have access to surgery and rehabilitation that restore function. Population health encompasses health outcomes and the determinants of health in groups of humans at the community, regional, national, and/or worldwide level. Determinants of health are the biological, behavioral, social, environmental, political, and other factors that influence the health status of individuals and populations. Individual behaviors like hand washing often eat several portions of fruits and vegetables daily, and using sidewalks rather than walking in traffic contribute to reducing the risk of infections, managing chronic diseases, and preventing injuries at the individual level. But the ability of individuals to engage in these activities is a function of both individual power and community resources. If someone lives in a community that does not have public washrooms, affordable fresh foods, and pedestrian walkways, these actions may be impossible. Community wide interventions related to those determinants of health will enable individuals to adopt healthier behaviors that improve their own health outcomes. When the health outcomes of individuals improve, the overall health status of their community also improves. A similar pattern exists for the health of nations. Worldwide efforts related to the determinants of health can improve health outcomes in all the participating countries. 1.3 Prevention and Intervention Science. Global health is an action oriented field that works to improve health status for every age group and extend healthy life expectancy for any individual. An ideal health trajectory begins with a consenting adult becoming pregnant and that pregnancy leading to an uneventful full term delivery of a healthy newborn. After birth, the ideal health trajectory continues with that healthy infant growing into adulthood without experiencing serious infections, illnesses, or injuries, and that adult remaining healthy and active for many decades. Because everyone eventually dies, the ideal health trajectory ends in very old age with a gentle death that is not preceded by months or years of disability and pain. However, a few people achieve this ideal pathway. In very low income communities, a large proportion of children are born with low birth weight and struggle with repeated bouts of infectious diseases like pneumonia and malaria, and it is not uncommon for young women to die in childbirth. A healthy child may develop permanent physical impairments due to a catastrophic car crash in adolescence, have reduced health status from alcohol abuse or misuse of prescription painkillers in middle adulthood, and then die from a heart attack before reaching retirement age. Even when people live to be very old, they usually experience a gradual decline in function and loss of independence prior to dying. Actions implemented at the individual, community, and higher levels can prevent many of these events that decrease health status and can lessen the level of reduced health associated with them. Check out this diagram. Oh, here's another diagram. Wow. Cool. Global health and intervention is a strategic action intended to improve individual and population health status. A variety of behavior, social, economic, environmental, and other interventions and changes can help individuals and their communities make progress toward having longer, healthier life trajectories. For example, nutrition support programs for pregnant and breastfeeding women reduce the risk of low birth weight and malnutrition in infants. The use of antibiotics to treat childhood pneumonia soon after the onset of a cough can prevent life threatening illness. The availability of skilled birth attendants can prevent women from dying during childbirth, and numerous other interventions during adulthood, such as injury prevention technology, mental health care, and lifestyle changes that reduce the risk of heart attacks, can improve both quality of life and the number of years lived. Together, these interventions can have a strong positive impact on an individual's health, allowing a person who might otherwise have experienced poor health in childhood and die young to instead have a healthy childhood and live to old age. When these interventions reach millions of people, they have a huge difference in population health, happiness, and productivity. The adage that prevention is better than a cure expresses one of the foundational principles of global health. It is usually cheaper to spend relatively small amounts of money on interventions that keep people healthy across the lifespan than it is to spend relatively large amounts of money helping people recover from health crises. Lengthy hospitalizations, long-term disabilities, and untimely deaths are expensive and exhausting for the affected individuals and their families and caregivers. They are also costly for the communities and nations that lose the economic, social, and other contributions that affected individuals would have made through work productivity, tax revenue, and service if they lived longer, healthier lives. Systems thinking is the process of identifying the underlying causes of complex problems so that sustainable solutions can be developed and implemented. Prevention science is the process of determining which preventative health interventions are effective at improving health status, how successful those interventions are in various populations, and how readily they can be scaled up for widespread implementation. Implementation science is the scientific study of how to increase uptake of evidence-based practices and policies after effective interventions have been identified. Some more diagrams. Yeah. There are three levels of prevention that together capture the full range of health interventions. Primary prevention consists of protective actions that help keep an adverse health event from ever occurring. Some primary prevention interventions promote healthy behaviors such as vaccinating children to reduce the risk of contracting measles and polio infections, keeping mosquitoes out of homes to reduce the risk of malaria and other vector-borne diseases, and using a seatbelt to reduce the risk of severe injuries during a motor vehicle collision. Some primary prevention programs work to modify the health environment by increasing access to improved sanitation to prevent diarrheal infections, spraying insecticides to kill the mosquitoes that spread dengue virus, implementing clean delivery room practices to prevent infections uh, of newborns and their mothers, and building roads that are safe for bicyclists and pedestrians. Others use policy changes to improve access to healthcare services, essential medications, and nutritious foods. Primary prevention interventions are often the most cost-effective interventions, but there are many adverse health conditions for which the risk factors remain poorly understood, and the options for primary preventions therefore remain limited. Secondary prevention is the detection of health problems in asymptomatic individuals at an early age when the conditions have not yet caused significant damage to the body and can be treated more easily. Asymptomatic means not symptomatic. Cancer screening tests such as mammography for breast cancer, pap smears for cervical cancer, and colonoscopies that look for the polyps that are precursors to colorectal cancer, colorectal cancer are forms of secondary prevention. Similarly, routine HIV tests, blood pressure checks in adults, and sports physicals for student athletes are intended to detect health issues in people who might otherwise have remained unaware of the presence of manageable but potentially serious health conditions for many years. Tertiary prevention consists of interventions that reduce impairment, minimize pain and suffering, and restore function in people with symptomatic health problems. Examples of tertiary prevention include managing chronic diseases with medication, alleviating the pain that can be caused by advanced cancer, and providing physical therapy and occupational therapy to people recovering from strokes or serious injuries. Given the three levels of prevention, there is almost always some intervention that can improve the health of individuals who are vulnerable to various adverse health conditions or are already sick. Primary prevention is the preferred option, especially when a cost-effective intervention is available. When primary prevention is not possible with current technologies and when health problems are already present, secondary prevention and tertiary prevention can improve longevity and quality of life. One point four, risk factors. The ability of individuals, nations, international partnerships, and other groups to make informed decisions about what interventions to invest in and collaborate on is dependent on understanding the risk factors for adverse health outcomes. Etiology is the cause of a disease or another adverse condition. The proximal cause is the most immediate cause of an adverse event. For diseases, the proximal etiology agents may be intrinsic, internal causes such as genetics and psychological factors, or extrinsic, external causes such as infections and environmental hazards. Beyond proximal causes, there are many other factors that contribute to creating the situations in which illness and diseases occur. A distal cause is a social, environmental, or other factor that is not an immediate cause but contributes to the causal pathway for an adverse event. Epidemiologists and prevention scientists are often able to identify a variety of immediate exposures that are associated with increased risk of illness, but it is harder to quantify the ways that social, economic, political, historic, and other distal factors that are parts of causal webs have created and perpetuated public health problems. Research by anthropologists, sociologists, and other social scientists and humanities scholars provide insights about the ways that political structures like colonialism, capitalism, prejudices like racism and sexism, and other contextual factors have shaped and continue to shape health. For most adverse health conditions, there are many different combinations of events that might lead to the onset of progression of the disease or disorder. Multi-causality describes a causal pathway in which many risk factors contribute to an adverse event occurring. The terms necessary and sufficient are often used to describe the various sets of exposures that can lead to adverse outcomes. A risk factor is said to be a necessary part of the disease pathway if it must be present for a person to develop a disease. For example, an individual can have a genetic disorder only if he or she carries the gene for that disorder. The gene is necessary. A risk factor is sufficient if that exposure or characteristic by itself can cause disease. Being exposed to a high dose of radiation could be sufficient to cause some types of cancer, but most of those cancers could also develop in someone ex- who was never exposed to radiation. Radiation is sufficient but not necessary to cause cancer. Some exposures are necessary but not sufficient on their own to cause disease. Many adverse health outcomes result from dozens or even hundreds of exposures that are neither sufficient nor necessary on their own, but in the aggregate can lead to a situation in which an infection, illness, or injury occurs. Consider the example of child pneumonia, which is a more frequent cause of pediatric mortality than diarrheal diseases, malaria, HIV, or injuries. Nearly 1 million children die from pneumonia each year, and almost all these deaths occur in lower income countries. A variety of pathogens can cause child pneumonia, and there are countless sets of distal and proximal causes that may lead to a child contracting a respiratory infection. Medical interventions tend to focus on the proximal causes of pneumonia cases and deaths, emphasizing primary prevention methods like vaccination and tertiary prevention methods like access to antibiotics. A more comprehensive prevention package will include interventions related to distal causes as well as proximal ones. An exposure is a personal characteristic behavior, environmental encounter, or an intervention that might change the likelihood of developing a health condition. Individuals may have different risks of infection, disease, and complications from disease as a result of age, genetics, immunology, comorbidities, nutritional status, health behaviors, psychological factors, environmental hazards, and many other characteristics. A risk factor is an exposure that increases the likelihood of experiencing a particular health outcome. Some risk factors are specific to one disease, but many biological, behavioral, environmental, and other risk factors are associated with a diversity of adverse health outcomes. For child pneumonia, some of the risk factors are biological. Infants and young children may have underdeveloped immune systems that leave them vulnerable to certain types of pathogens, or they may have poor immune response due to being chronically undernourished. Some risk factors are environmental. Children who are exposed to indoor air pollution from cooking fires and children exposed to outdoor air pollution because they live in dirty industrial areas are more susceptible to respiratory infections. Some risk factors are social, economic, or behavioral. Parents who have never attended school or had the opportunity to learn how to read may not have the education or to recognize when a child requires medical assistance. Parents who are subsistence farmers or work for a very low wage might not have the money to pay for transportation to a hospital when a child is critically ill. In prevention science, the term primordial prevention is sometimes used to describe the general lifestyle habit and environmental conditions that prevent risk factors for adverse health events from developing. In that framework, primordial prevention is about general conditions that protect health, such as eating a nutritious diet, exercising, avoiding tobacco and other harmful substances, and getting adequate sleep each night. And primary prevention is about specific actions that mitigate the risk of developing specific diseases. A person who eats a low-fat diet to help keep blood lipid levels low is practicing primordial prevention. A person with elevated blood lipid levels who takes cholesterol-lowering medication to reduce the risk of cardiovascular disease later on is practicing primary prevention. A person who chooses not to start smoking is engaging in primordial prevention. A tobacco-using person who works to quit smoking to reduce the risk of developing lung cancer later on is engaging in primary prevention. For child pneumonia, primordial prevention includes conditions such as adequate nutrition and clean air. The links between hundreds of exposures and child pneumonia have been confirmed by health researchers. Causation is a relationship in which an exposure directly comes. A causal factor is an exposure that has been scientifically tested and shown to occur for the disease outcome and contribute directly to its occurrence. An association is a statistical relationship between two variables. But tests of association are not enough to prove that a relationship is or is not causal. The presence of causality is typically determined by using both quantitative analysis, such as laboratory testing and statistics, and a qualitative consideration of causal theory. The Bradford-Hill criteria are a set of conditions that provide support for the existence of a causal relationship between an exposure and an outcome, such as the strength of the association, the presence of a dose-response relationship between the exposure and outcome, of the consistency of the risk across numerous studies. There is no expectation that all of the Bradford-Hill criteria have to be met for an exposure to be considered causal, but the evidence for causality is stronger when the more criteria are met. When many different exposures contribute to the onset and progression of a disease, many different interventions can be effective at preventing adverse outcomes. An individual's health status at any age is a function of his or her experiences through the life course. Some of the circumstances that lead to adverse health outcomes are ones that cannot be altered. A non-modifiable risk factor is a risk factor that cannot be changed through health interventions. We do not have the ability to change a person's age or the technology to change a person's inherited genes, and we cannot erase past behaviors and previous medical events that have damaged the body. However, there are many actions that support improved health today and reduce the risk of health problems in the future. A modifiable risk factor is a risk factor that can be avoided or mitigated. For example, a behavioral risk factor is a behavior that can be adopted, stopped, or changed in order to reduce the risk of disease. Behavior change interventions may encourage the reduction of hazardous behaviors or may promote the adoption of healthier behaviors. Some modifiable risk factors can be mitigated with behavior change at the individual or household level. For child pneumonia, health education programs can encourage parents not to cook indoors without adequate ventilation and can teach parents the importance of seeking medical care for children with moderate breathing difficulties rather than waiting until the onset of severe respiratory distress. However, many risk factors can only be mitigated at the community level or higher levels. One family can force a factory to stop releasing toxins into the air. Reducing outdoor air pollution might require a national clean air law to be enacted and enforced. One small rural community will not have the resources to build and staff a hospital that provides affordable, high-quality services. Rural communities could pool their funds to establish a network of clinics, but they would probably need to coordinate their efforts with an urban referral hospital and with a national organization that trains and certifies rural health workers and other clinical care providers. One country, one county, or parish will not be able to develop and manufacture all the medications and vaccines its residents need. Pharmaceutical products are typically developed by international research teams, and few factories have the technical capacity to produce chemically complex substances that are reliably safe and effective. One nation cannot prevent antibiotic-resistant bacterial strains from emerging and spreading across the globe. If all countries do not work together to promote antimicrobial stewardship and combat drug resistance, respiratory infections that are currently curable may cause widespread death in the future. Reducing child deaths from pneumonia requires a mix of individual and household level, community level, national level, and global interventions. It can be comforting to assume that individuals have the power to control their own health destiny, but that is a false assumption. Health is a complex function of individual interpersonal factors plus interpersonal factors, relationships, interpersonal, relationships, institutional and organizational factors, community factors, and public policy. Many people do not have the ability to choose to eat healthy meals, exercise daily, breathe fresh air, get enough sleep, access routine medical screenings, and manage child health conditions so that they do not become severe. Low-income individuals and households may not have the money to buy adequate amounts of nutritious food, time to do much of anything other than work, or the resources to access health services. Even the world's richest people do not have full control over their personal health trajectories. Some people who apply the best available science to every aspect of their lives will still become seriously ill long before they reach old age. The factors that cause their health status to diminish may be ones that they cannot control. Even billionaires do not have the ability on their own to ensure that the influenza vaccine they get annually will protect against the strains that end up circulating in a particular year, that the air they breathe outside their homes is clean, or that the other motorists they encounter on public roads will not be driving recklessly. Individuals can and should accept responsibility for their own health decisions, but there are some threats to health that can only be solved at the population level. The health of individuals is a function of their own biology and behaviors, but also a function of a broad set of economic, social, cultural, political, environmental, occupational, and other factors. For many adverse health outcomes, the distal causes of the health problem are ones that cannot be solved by individuals or even by states, provinces, or nations acting alone. Many threats to health can be resolved with global cooperation. 1.5. A health transition is a shift in the health status of a population that usually occurs in conjunction with socioeconomic development. 100 years ago, most populations across the globe had similar health profiles: high birth rates, high child mortality rates, short life expectancies, and a considerable proportion of illnesses and deaths due to infections and undernutrition. During the 20th century, high-income nations transitioned to having longer life expectancies and lower rates of infection and chronic hunger. Low-income countries did not experience such dramatic improvements in population health status. Because low-income countries did not undergo the health transition observed in high-income countries, gaps in health equity between the highest and lowest income countries increased. Population health status is related to socioeconomic and environmental factors. Places with more poverty and pollution tend to have limited access to health services and less favorable health profiles. Economic growth, infrastructure development, and new health technologies in high-income countries in the 20th century enabled high-income countries to improve population health in all age groups. In the United States, for example, The leading causes of death in both 1800 and 1900 were pneumonia, including pneumonia caused by influenza, tuberculosis, and diarrhea, all of which are infectious diseases. Many of these deaths occurred in children and young adults. By 1950, the risk of dying in childhood or early adulthood had decreased considerably, and the most frequent causes of death had shifted to heart disease, cancer, and stroke, the same aging associated diseases that remain the most frequent causes of death in the United States today. These changes in population health status are attributed in part to vaccines, antibiotics, contraceptives, and other medical advances, but they were also the result of improved sanitation, better nutrition, increased education, and economic growth. The risk transition is a health transition characterized by a shift from exposures with undernutrition, unsafe water, and indoor air pollution that increase the risk of childhood infectious disease, causing most preventable morbidity and mortality in a population to exposures like obesity, physical inactivity, and tobacco use that increase the risk of chronic disease, being the most prominent risk factors. As the risk transition occurs, the major causes of illness and death change. Comparing high, middle, and low income countries provides insights into how these health transitions occur. Medical, Middle income countries tend to have health and risk profiles that are somewhere between those of low income and high income countries. Middle income countries usually continue to have some populations burdened by undernutrition and infectious diseases, while other populations within the same country experience the challenges associated with obesity and chronic non communicable conditions. This need for health systems in middle income countries to be responsive to both pre transition and post transition health problems is sometimes called the dual of double burden disease. Major risk factors for reduced health status and early education. Sorry, let me start that one over. Major risk factors for reduced health status and early death in countries with low, middle, and high socio-demographic status. Some health and risk transitions are not wholly favorable ones. Global health interventions seek to postpone death and prevent disability. People who live in high income countries often live to old age, but many older adults are disabled by chronic diseases and experience a lot of pain. Increasing rates of obesity and sedentary lifestyle among younger adults are likely to exacerbate the burden from non communicable diseases in post transition countries in the coming decades. However, transitions that shift the burden of death and disease from children and young adults to older adults are considered to be population health successes. Everyone will eventually die of something, but a population is healthier when the typical age at death is 85 years rather than 65 years. Since hunger and infectious diseases tend to disproportionately burden children, a shift toward obesity and chronic diseases that usually affect older adults is a relative improvement in population health. A health disparity A health disparity, also called a health inequity, is an avoidable difference in health status between population groups. Health disparities can be observed between countries and within countries. One of the key goals of global public health is to reduce health disparity by increasing the health status of disadvantaged populations through interventions that target proximal or distal causes of suboptimal health. Minimizing health disparities by reducing the health status of advantaged populations would not be global health gain. Health equity is only achieved when progress towards Greater health occurs in all populations. 1.6 Global Health History and Functions. Long before bacteria were first viewed through a microscope, people were aware that travel and trade. 4 o'clock. Okay. Long before bacteria were first reviewed through a microscope, people were aware that travel and trade could bring deadly diseases into vulnerable populations. Thousands of years ago, people with skin lesions and other lesions of disease were ostracized and forced to live away from healthy looking people. Hundreds of years ago, port authorities started requiring incoming ships to stay in harbor for several weeks before they could dock and allow crew members to disembark and goods to be offloaded. Modern transportation has accelerated the speed at which pathogens can spread to new locations through international travel and trade, but the population health threats associated with globalization are long established concerns. One of the primary goals of early international health pacts has to limit the spread of dangerous infections. For example, a series of international sanitary conferences held in various European cities starting in 1851 assembled representatives from several countries to discuss concerns about the shipping industry spreading to new ports. The delegates sought to identify policies and practices that would protect population health while allowing international supply chains to follow uninterrupted. The signatories of the resulting agreements committed to notifying other countries about outbreaks of cholera, plague, yellow fever, and other epidemic diseases, and they pledged to monitor health at ports and impose quarantines on disease-carrying ships. By the early 1900s, international regulations also incorporated several other cross-border health issues, including ones related to water pollution, alcohol, opium, and other drugs, and occupational health and safety. These treaties set the stage for the international health regulations, which were approved by the World Health Organization 100 years later in 1951 and are still in force today. Economic and political interests were central to early investments in international health. By around 1870, the Industrial Revolution had transformed manufacturing and rail networks, enabled mass movement of people and goods across land. European countries that had colonized the Americas and parts of Asia and the Pacific in previous centuries began laying imperial claim to more of Africa's natural resources. The United States, Russia, and Japan also required overseas territories so that they could access raw materials, take advantage of cheap labor, expand the market base for the goods they produce, and control strategic military positions. Many of these colonies and territories were located in tropical climates where mosquito-borne infections like malaria and yellow fever were constant threats. The field of tropical medicine was established in the late 1800s and early 1900s as more European and American businessmen, military personnel, and their families relocated to tropical areas to oversee commercial and defense activities. Tropical medicine specialists aim to protect settlers and visitors from parasitic and infectious diseases and ensure that the workforce in these areas was healthy enough to be productive. Here's a picture of the Panama Canal. Today, some of the functions of tropical medicine are performed by travel medicine specialists. Tropical medicine was also the precursor for the field of international health, a term that in current usage usually describes efforts to alleviate poverty related health conditions in lower income areas, not just the tropics. International health interventions typically involve cooperative efforts between a high income country sponsor and one or more lower income country recipients who work together to improve a health issue that is a public health priority in the lower income country. Many international health programs have humanitarian origins and aims that overlap with commercial and diplomatic motivations. Charitable projects that improve the health of adults and children in recipient countries enable more workers and consumers in those countries to participate in the global economy. That outcome can generate economic and other benefits for all the collaborating countries. One of the criticisms of some traditional ways of doing international health is that partnerships between high income donor countries and lower income recipient countries perpetuate power hierarchies rather than promoting true equity among partners. Calls to decolonize global health push for wider recognition of how colonialism and settler colonialism, which occurred from when European immigrants to the United States, Canada, Australia, and other places participated in a systemic process that displaced indigenous populations and took possession of their lands, have harmed and continue to harm individual, public, and global health. Decolonizing global health requires rethinking global health concepts and practices, as well as improving diversity, equity, and inclusion within the global health workforce. The distinction between international health and global health is still under debate, but global health interventions are more likely to include partners from many countries across the income spectrum. Rather than being sponsored by one high income country, emphasize how globalization processes affect the health of all people, rather than focusing exclusively on the most disadvantaged populations. And apply interprofessional and multi-sectoral lenses to the development and implementation of public health interventions. International health efforts often have an intergovernmental focus, whereas global health initiatives typically welcome people from government, nonprofit foundations, and corporations. The global HIV epidemic of the late 1990s demanded new models for how countries from all world regions and all income levels can work together to respond to shared threats to population health. The success of the broad based collaborations that were formed to accelerate scientific discoveries related to HIV/AIDS and to increase access to HIV medications showed that global partnerships can achieve their goals. Over the past 20 years, many large global partnerships have been formed to address numerous population health issues. Some focus on security threats that require commitments from every country in the world, such as antimicrobial resistance, food safety, emerging infectious diseases, global climate change, and geopolitical violence. Some focus on the traditional foci of international health investments, infectious disease prevention and control, including support for vaccination and eradication campaigns, responses to famines, natural disasters, and humanitarian crises, and and promotion of maternal and child health and survival through literacy programs, micro loans, and other community development activities, as well as directly health related ones. Some partnerships have goals related to non communicable diseases, mental health, emotion, injury prevention, and healthy aging. A century ago, international health was a recognized tool for promoting economic and political stability, a component of diplomatic efforts, and a foundation for economic and infrastructural development. Today, global health continues to serve an important role in enabling international trade and travel, fostering safety and security, and promoting sustainable development. 1.7 Global Health Achievements. Yeah. Global Health Achievements. Innovations in health technology over the past 100 years have created an incredible set of tools for global health work. New antibiotics were discovered along with a host of medications for managing and treating non communicable diseases like heart disease, cancer, and diabetes. Life saving vaccines were developed, smallpox was eradicated, oral contraceptives transformed family planning, and assistive reproductive technologies enabled many couples with infertility to have biological offspring. Electrocardiographs, electrocardiographs, magnetic resonance imaging, and other new diagnostic tools improve the quality of medical care. New therapies like dialysis for kidney disease and contact lenses for vision impairments enhance quality of life. Modern surgical techniques made joint replacement, open heart surgery, transplants routine in some parts of the world. These technological advances enabled many of the top 10 public health achievements of the 20th century that were highlighted by the U.S. Centers for Disease Control and Prevention at the start of the new millennium, as well as many of the leading global health achievements during the first years of the 21st century. While these health technologies are indisputable beneficial, the uneven distribution of access to them generated a massive intensification of health disparities. During the 20th century, people living in the world's richest countries now have access to an array of tools for health that would have been unimaginable 100 years ago, while children living in the world's poorest areas continue to succumb to easily preventable conditions like starvation and vaccine preventable and antibiotic treatable infectious diseases. Global health aims to end these disparities by using a holistic, comprehensive approach to improving population and planetary health worldwide. Thanks to coordinated global health and development initiatives, the 21st century has already seen improvements in health equity. Life expectancies and other health metrics are improving in low and middle income countries, even as these measures hold steady or continue to improve in high income countries. The goals of global health in the 21st century include continuing to create innovative solutions to public health problems, increase access to healthcare services and health technologies around the world, and expanding global communication and action about shared health concerns. Population health is not a zero-sum game in which one country can win only when another country loses. Everyone gains when the world health increases. And I finally made it to the end of chapter 1. Now, took about an hour. Dare I even read chapter 2? Should I do it? Let's end it here.